Thanks, Wendy, for your introduction of our project. And next, I will go over the data overview of COVID-19 modeling. So it will have several parts. The first will be the categories of models and what kind of data are used in these models. And second, it will be the details of different data sources used in the models. And third part is about the benchmark data sets we try to create on the CDL platform, and also some several models that we have been replicated based on the workflows. So for the COVID-19 models, it can be categorized by different perspectives. For example, by objectives, some kind of models are used for predicting the confirmed cases, mortality rates, and some kind of models used for to evaluate the health facility capacities, and also can be used to evaluate the policy effectiveness, and also the impact of COVID-19 to economics and human behaviors. By the methodology, the models can be classified to the epidemiology, such as the ESIR that the UM team just presented in the previous presentation, and also some other models like HS model, machine learning models, and regression models. So this is listed in the CDC website. Actually, these are the models that have been reported to the on the CDC website. And this you can see here the models. Most of them use the SCR models, and several of them use agent-based model or machine learning models. And based on this, we summarize what kind of data are used in these models. And so here are several examples. These are data sets used for different models. So like the AHME, the COVID scenario pipeline from Johns Hopkins University, and also Georgia Tech have two models here. So these four models, they employ the cases data, including the confirmed cases, also like the death cases from Johns Hopkins University dashboard, and some of them from the USA Facts. And besides the cases, the data they also involve like the mobility data sets and also some census data sets. And for the IHME model, it is different from other four. It is that they use the mask use and also environment factors for the prediction. And besides the CDC, the models reported in the CDC, we also do some research based on the publications on Web of Science. So we search the keywords of COVID-19 plus model, and here are the results of about the applications of different models. And most of them are used for the environmental health and infection disease, public health, life science, business economy, and etc. So based on the models here in the publications and also listed in the CDC, we do have a summarization, and here's a flow chart about what kind of factors are involved in the models. So the factors can be the virus infections, healthcare, data, and mobilities, environment, policy, demographic, and social economics. And for these factors can be estimated based on different index or indicators. And we group them into two parts. For the first group is we call it quantitative index. For the quantitative index, they are estimated by the census data or statistical data. These data sources are more like a structured data set. And however, for the derivable index, this index can be estimated based on the social media, news, remote sensing, and literatures. So you can see here, these data sets in forms of the text and also images. So this is more like an unstructured data set. So based on these different kinds of indicators, we can evolve to or introduce to the different models and for different applications. So next, I will talk about more details about the data sources for quantitative index. The first is about the COVID-19 cases data sets. So I think most of you have known that these three data sets, these data sets are most popular in the research. including WHO, the ECDC, and Johns Hopkins. I just want to mention one thing here is that although they have similar trends for the cases numbers, however, for Johns Hopkins University, they have estimates higher. They have higher numbers of cases because they may estimate the presumptive positive cases. So what is presumptive positive cases? It's kind of cases that's considered or it is confirmed by the local or state the department, the government. However, it's not confirmed by the national lab. So that's why it's sometimes has higher numbers than other two data sets. And the second data set is about the United States, the US COVID-19 cases data set. And Johns Hopkins University, US Facts, and New York Times, they have similar data sets. They cover the cases numbers, both in the United States and counties levels. However, for the fourth data set, COVID tracking project, it is different. Other four, it is just cover the states level, the cases. However, it has the total test numbers. It has ICU, the ventilator use, and hospitalization numbers. And from there, another difference is about their quality. So the COVID tracking project awards each state a letter grade between A to D based on the state's reliability and confidence. This is totally different from other three data sets.